Welcome to Bloodborne Pathogens training. This training covers the federal OSHA required components. It's important to note that site-specific information cannot be included in an online training. Please follow up with a supervisor if you have additional questions regarding site-specific information, as well as anything that might arise directly from this training. This training is divided into 9 sections. There will be a short quiz following each section. After watching the entire video and completing the 9 quizzes, a certificate of completion will be generated. The first section in this training covers the background of bloodborne pathogens. On December 6, 1991, OSHA's Bloodborne Pathogen standard became the law. This is a regulation that prescribes safeguards to protect employees against health hazards related to bloodborne pathogens, also known as BBP. Bloodborne pathogens. Pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include, but are not limited to, hepatitis B virus, hepatitis C virus, and human immunodeficiency virus. The Bloodborne Pathogen Standard was revised by the Needle Stick Safety and Prevention Act of 2000. This act further detailed OSHA's requirement for employers to identify, evaluate, and implement safer medical devices, which must be used to reduce or eliminate exposure. The Act also mandated additional requirements for maintaining a SHARPS injury log and for non-managerial healthcare employees to evaluate and participate in choosing SHARPS devices. These employees must be responsible for direct patient care and have the potential to be exposed to injuries from contaminated SHARPS. Contaminated. The presence or the reasonably anticipated presence of blood or other potentially infectious materials on an item or surface. The Needle Stick Safety Act directed OSHA to revise its bloodborne pathogen standard, and this revision took effect April 18, 2001. Some states have OSHA-approved job safety and health programs operated by individual states. These are known as state plan states. Currently, 26 states, plus Puerto Rico and the U.S. Virgin Islands, have an OSHA-approved state plan. This plan must meet the minimum enforcement requirements of federal OSHA. Many of these states have requirements far exceeding federal OSHA, especially in areas specific to that state, such as mining or petroleum. Please be aware that some state plans only cover certain groups of employees. The following states have OSHA-approved state plans: Alaska, Arizona, California, Connecticut, Hawaii, Illinois, Indiana, Iowa, Kentucky, Maine, Maryland, Michigan, Minnesota, Nevada, New Jersey, New Mexico, New York, North Carolina, Oregon, Puerto Rico, South Carolina, Tennessee, Utah, Vermont, Virgin Islands, Virginia, Washington, and Wyoming. State plan states and federal OSHA. This training is based on federal OSHA guidelines. At the conclusion of this training, there will be an opportunity to check your state to determine if there are differences between federal OSHA BBP and your state's BBP guidelines. States with more stringent requirements will be briefly addressed individually at the end of the training. OSHA's Bloodborne Pathogen Standard, including its 2001 revisions, applies to all employers who have an employee with occupational exposure. This means reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious material, also known as OPIM, that may result from the performance of the employee's duties. These employers must implement the requirements in the standard. Some of the provisions in the standard apply only to healthcare settings, but other provisions, particularly the requirements to update the exposure control plan and to keep a SHARPS injury log, apply to non-healthcare as well as healthcare settings. OSHA's Bloodborne Pathogen standard applies to all employers with employees who have occupational exposure to blood or other potentially infectious materials, regardless of how many workers are employed. Other potentially infectious materials. This list includes vomit, only if visible blood is present; feces or urine, again only if visible blood is present; saliva in dental procedures; semen; vaginal secretions; cerebrospinal, synovial, pleural, pericardial, peritoneal, and amniotic fluid; body fluids visibly contaminated with blood; all body fluid in situations where it's impossible to differentiate between body fluids; any pathogenic microorganism; any unfixed human tissue other than intact skin or organs; HIV containing cell or tissue cultures or organ cultures; HIV or HBV containing culture medium or other solutions; blood, organs, or other tissues from experimental animals infected with HIV or HBV. However, the offices and clinics of medical doctors and dentists, and those with fewer than 10 employees company-wide at all times of the year, are exempt from the requirement to keep a log of occupational injuries and illnesses, and thus exempt from maintaining a SHARPS injury log. All other applicable provisions of the Bloodborne Pathogen standard still apply. Please be advised that state plan states may not follow federal OSHA's exemption on the reporting requirement. Listed are several of the occupations that are covered by the BBP standard: physicians, physician assistants, nurses, nurse practitioners, and healthcare employees of clinics and offices; employees of clinical and diagnostic laboratories; housekeepers in healthcare facilities; employees in hospital laundries or commercial laundries that serve healthcare or public safety institutions; employees of blood or tissue banks; employees of freestanding clinics such as hemodialysis, urgent care, or family planning; employees of correctional institutions that have contact with other potentially infectious material, or OPIM; employees that provide emergency first aid; dentists, dental hygienists, dental assistants, and dental laboratory technicians; hospice employees; home health care employees; employees of nursing homes and long-term care facilities; employees of funeral homes and mortuaries; employees handling regulated waste. Regulated waste includes the following: liquid or semi-liquid blood or other potentially infectious materials; contaminated items that would release blood or other potentially infectious material in a liquid or semi-liquid state if compressed; items that are caked with dried blood or other potentially infectious materials and are capable of releasing these materials during handling; contaminated sharps; pathological and microbiological wastes containing blood or other potentially infectious materials; EMTs and paramedics; firefighters and law enforcement personnel. The Bloodborne Pathogen standard has a set of requirements that employers must follow. This set includes: provide a copy and explanation of OSHA's Bloodborne Pathogen standard; establish an exposure control plan and ensure employees have knowledge of this plan; update the exposure control plan annually; implement the use of standard precautions. Standard precautions: A set of precautions designed to prevent transmission of bloodborne pathogens. Under standard precautions, blood and certain bodily fluids of all patients are considered potentially infectious for bloodborne pathogens. Identify and use engineering controls. Engineering controls. Control measures such as sharps disposal containers, self-sheathing needles, and safer medical devices that isolate or remove the bloodborne pathogen's hazard from the workplace. Identify and ensure the use of work practice controls. Provide personal protective equipment or PPE as needed. Use labels and signs to communicate hazards. Make available hepatitis B vaccinations to all employees with occupational exposure. Occupational exposure. Reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious material that may result from the performance of an employee's duties. Make available post-exposure evaluation and provide follow-up for any occupationally exposed employee who experiences an exposure incident. Exposure incident. Specific eye, mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials that results from the performance of an employee's duties. Provide information and training to employees at least annually. Maintain employee medical and training records. Many of these requirements will be explained in detail throughout this training.